It's possible you've done some genetic testing to find out where your ancestors are from, but our DNA can also tell us what diseases run in our genes. That science is now being used in preventative health care.
I was in a foster home for a few months.
When we go to the doctor, we're asked to share our family's medical history, but Emma Pedersen has never known hers.
I was born in Busan, South Korea, I was eventually adopted to my family here in Minnesota. And through that adoption process, closed adoptions were more common at the time. So I don't have hardly any information about my birth parents. And because of that, I also don't have any family health history.
Last year, Pedersen found out she could take a DNA test that would search for markers of genetic diseases.
Once I got my results, I was really relieved to find that I didn't test at a higher risk for any of the genetic markers.
Now, if Pedersen did have any of the markers, Leslie Dawkin with healthcare company Health Partners says she'd be able to start preventative care.
My sister-in-law had a genetic test early on and was told she had the BRCA1 gene and that she was at higher risk for breast cancer. So she followed very closely with her physicians, and they watched some changes in her breast tissue and other things, and then she took preemptive steps and actually had a mastectomy before she developed her cancer.
Health Partners is part of a network of hospitals using saliva and blood samples to help people identify what they could be at risk for.
We look for BRCA1 or BRCA2, so breast cancer risk. We look for colorectal cancer risk, and then anyone with a significantly elevated cholesterol, which drives to early risk for cardiac disease.
They've partnered with Helix, a population genomics company that works with healthcare systems all over the United States.
About 8 or 9 out of every 10 people walking around have a risk for one of these conditions and don't know about it because our medical guidelines are just not catching all the people.
Helix Vice President of Medical Affairs Alyssa Levin says the most exciting aspect about DNA is that it never changes.
We can actually collect a person's sample once. We can sequence or read that information and securely store it, like we're locking it in a safe vault.
So as science evolves and we can test for more diseases, Levin says that information will already be accessible. Dawkins says it's also made it more affordable.
Every time I have a new question, I can just query the data. I can just look into a database and find an answer. That is very inexpensive compared to running another $3,000 test, another $5,000 test, another $10,000 test. Because previously we didn't have a way to store that data and store it easily.
With more than 75,000 genetic tests on the market, Johns Hopkins Medicine says the expansion of DNA tests and improvement of technology has made testing cheaper. But right now, Health Partners and Helix is offering the test for free if people agree to participate in research.
Our goal is that we're building enough of a body of research to show how important genetics is to early identification, to being able to help prevent these diseases or catch them early in stage 1, that more and more people will join into this effort.
Dawkins says we're at a turning point where our genetics can tell us which drug therapies will work for us and which medications will give us side effects. That's why she says it's important for people of all populations to participate in genetic testing. She says people of color are underrepresented in genetic databases across the country.
There's been a lot of historical trauma in the research field, and so there are people who are very hesitant to participate. But by participating and becoming, knowing your own risk, right, to support your family and your own health, but you also are helping make sure that the new drugs and the new therapies are there and will actually work for everyone in all kinds of different backgrounds and races coming forward.
Elizabeth Ruiz, Scripps News, Minneapolis.